Hello and welcome to Health Mantra. I'm your host Heather, and today we're here to bust some of the biggest myths in modern cancer care. The topic, radiation therapy, a treatment that saves lives every day, yet it remains one of the most feared and misunderstood areas in cancer care. Can it burn your skin? Is it safe long term? Does it do more harm than good? There's a lot of misinformation out there. And for anyone facing a cancer diagnosis, these myths can add unnecessary fear to an already difficult journey. Today we're here to set the record straight. For every myth, we will give you facts, backed not only by science, but by real clinical experience. And to do that, we're joined by one of the leading voices in the field, Dr. Vaibhav Shakya, a consultant in radiation oncology at Manipal Hospitals, Goa. Dr. Shakya is a highly accomplished radiation oncologist known for his work in the management of cancers, as well as imaging-guided brachytherapy and precision radiotherapy techniques. He is not only a skilled clinician, but also an active researcher, teacher, and speaker in the field of oncology. So whether you're a patient, a caregiver, or simply looking to know more, today's conversation is for you. Don't go anywhere. Hello, Dr. Vaibhav, and thank you so much for joining us here today.
Thank you. Thanks a lot for inviting me to your show.
Doctor, let's separate fear from reality. So for anyone unfamiliar with how it works, very briefly, could you tell us what radiation therapy is and how exactly it works in cancer care?
Yeah, definitely. So radiation therapy is basically the use of high energy X-ray photons or gamma ray photons which are used to treat cancer. Basically, it selectively kills tumor cells by inducing DNA damage in them, meanwhile preventing the surrounding normal tissues from damage.
But a lot of people believe that radiation causes more harm than good, that it burns healthy tissue. Is this true? Could you explain how modern radiation techniques work and how are they different from maybe, the way it was done in the past?
Yeah, definitely. We have evolved radiation therapy a lot since last 2 decades. All right. So earlier the side effects used to be a lot more. Right now we have reduced side effects to more than 70 to 80%. And meanwhile we have enhanced tumor control rates with the advent of modern radiation therapy that uses X-rays, high energy X-ray photons.
And despite all of this and despite the advancements, many believe that radiation is a last resort, that you only do radiation when there is no hope left. Is that true?
No, that is absolutely false. Actually, in fact, radiation therapy is used as a curative modality in many of the early stage cancers. For example, early stage clotic cancers, lymphomas, lung cancers, even prostate cancers. We use radical intent curative radiation therapy in the early stages to achieve cure rates, achieving 90 to 95%.
Doctor, another one, it may sound silly to you as a doctor, but many people believe that they become radioactive after something like radiation therapy, and they believe that it's the same as, the radiation that perhaps spreads after, say, a nuclear bomb or something. How true is this, or how false, how?
Okay. So, first of all, radiation therapy planning, it is a very sophisticated process. It involves defining exact target volumes that we intend to treat, right? And exact dose prescriptions, they are conformed to the tumor tissue. And every effort is undertaken to prevent radiation damage to the normal tissues. That is the modern therapy, number one. If you compare it with nuclear radiation leaks or blasts, so that is uncontrolled form of radiation, not necessarily X-ray photons, right? So this is a very calculated dose delivery with the intent of healing.
Thank you for clearing that up. Another one is many patients are told to stay away from loved ones, stay away from little children, stay away from pregnant women. Is that really, a piece of advice that is given, or is it a belief? Is it a false belief?
See, more than 95% of radiation therapy is external beam radiation therapy that we give currently using advanced radiation therapy machines known as linear accelerators, or LINACs in short, right? So more than 95% of treatment is being done on these machines. So it is absolutely safe to live a normal life while undergoing radiation therapy using teletherapy. Right? There is no, what do you say? There is no risk for any caregivers or family members or social gatherings, nothing at all. But 5% of treatments are of brachytherapy. Again, brachytherapy is of two types. It is of HDR and LDR. HDR means high dose rate, LDR is low dose rate. So LDR we used to give during previous times. Previously it was very popular. So in that, like for example, in prostate, we used to implant iodine 125 seeds in prostate, right? When that sort of brachytherapy is done, then the patient is radioactive for a couple of months, right? So during that period of time, pregnant women should not be near 6 feet of the patient.
Okay.
All right, that is one thing. But now, right now, mostly we use HDR, that is high dose rate brachytherapy, which is absolutely safe. In this, we use a remote afterloader technique, basically. What it is, we remotely load the source to the patient after implanting certain, you can say, small miniature tubes under anesthesia.
Okay.
So that while the patient is in the treatment room, it is heavily shielded. Patient takes the treatment over a few minutes or a few hours, and then patient is very safe to go home and intermingle with family members or society.
So there is
there is
contamination.
No risk. There is no contamination.
Neither clothes, your say your bed, your clothes. What about your material things?
Everything can be shared, except when there are implanted permanent seeds in your brachytherapy setup.
Can a patient also go about having a normal life, like your work, your social events?
Yeah, as I said, he can travel, he can work, he can even exercise. There's no harm to surrounding people at all, even to the utensils or to the clothes.
So food and everything can be shared. There's no problem.
He can live an absolutely normal life.
Doctor, let's talk about pain. Many people believe that radiation therapy is painful. What would a session actually feel like for a patient? Could you walk us through?
See, radiation therapy per se is totally painless. It is similar to getting your X-ray or a CT scan examination. All right. So, but the side effects, there are some side effects that might cause pain in the long term or in the short term, depending upon the tolerability of the patient, how well he tolerates. All right. So directly there is no pain at all. And even the side effects that we are talking of, pain and all, they used to happen more than two decades ago when we used to have only cobalt machines with us.
Okay.
That those machines cause more reactions to the skin surface that causes more ulceration and pain and all those things. With modern techniques, it is very highly conformal. So there is no pain. It is absolutely painless procedure. Radiation therapies.
You said it causes burns. Are you talking about skin damage? Is it permanent skin damage?
Yeah. So during more than 2 decades ago, when cobalt was the routine use, at that point of time, skin ulcerations were frequently observed, right? But with modern techniques, right now we have linear accelerators known as LINACs. Skin toxicity is like less than 5%. Severe burns that you call, they are first of all limited only to the area which is being radiated, number one.
So the
targeted, very targeted. And the intensity of them having grade 4 are very less than 5%. So
grade 4 burns.
Grade 4, yeah.
Another fear, one is the fear of burns, another one is the fear of hair loss. Is that always a given when it comes to radiation?
No, it depends upon the site. See, if there is radiation therapy being given to head, your brain, at that point of time you might experience temporary alopecia, means temporary loss of hair, but it is not permanent. It also depends upon the dose. And it is more pronounced with older techniques, not with the modern techniques, with LINACs or linear accelerators that we use.
Dr. Vaibhav, you said earlier something that some patients experience side effects. Are you talking about nausea, vomiting?
Yeah, nausea, vomiting, fatigue, these are all side effects, but they are again site specific. Like they are not common for all. For example, if someone is receiving radiation therapy to face and neck region, then the side effects would be skin erythema, just like sunburn, all right?
Okay.
Some degree of mucositis, oral thrush, some oral pain, small oral ulcerations that might develop. Again, they happen very infrequently and not in all patients, all right? If you are receiving radiation therapy to, say, chest area, then there might be some fatigue. Again, there will be no nausea. If you are receiving radiation therapy to anywhere in the abdomen, let's say stomach or pancreas or maybe rectum, you might experience some bloating or some loose motions, nausea, a few episodes of vomiting might happen. But again, all these side effects are very mild and well manageable with common medications.
So it all depends on which part of the body
Yes,
is
it
receiving
depends
the
on which part.
radiation.
The effects are highly localized.
Also, are they temporary? Do they go
They are
away?
temporary. Generally, most of the side effects go away between 3 to 6 weeks after finishing radiation on their own, even if you don't give anything. And if we give medicines, they are very well managed earlier also.
Okay.
Yeah.
Another fear that many people have is that radiation therapy causes other cancers in the long run, or that it causes recurrence. Is there any truth to this?
No, that is absolutely false. That's absolutely false. The risk of developing secondary cancers are less than 1% in 10 years.
Okay.
Yeah.
Due to therapy.
Yeah, due to radiation therapy.
Dr. Vaibhav, there's another myth that says that, how we said that some people believe that radiation is a last resort. Some people also believe that, it's advised when there is no hope left, or, it doesn't cure the cancer, it only delays the inevitable. Is it true? Does it just prolong, the lifespan?
See, that is absolutely false. As we just discussed, radiation therapy is used as a curative modality in early stage of various site-specific cancers, right? In combination with chemotherapy, it is used as a curative modality for cervical cancers and anal cancers. As neoadjuvant therapy, meaning the therapy that we give before definitive treatment, it is used in rectal cancers, in esophageal cancers, all right, even in soft tissue sarcomas. Then there is something known as adjuvant radiation therapy. Adjuvant means something that is given after the definitive treatment. So in head and neck cancer, it reduces recurrence chances by more than 50%. In breast cancers by 70%, right? And it increases the overall survival of breast cancer patients by almost 4% at 15 years. All right, so it has a definitive survival advantage.
So it's not just prolonging the inevitable.
Not at all.
What about the one that says that if a patient is advised radiation, that means that the cancer is spreading aggressively?
No, that is absolutely not true. Basically, what they mean by asking this is that if the disease is advanced, it is rapidly, then what is the role of radiation therapy? So in that, we give something known as palliative radiation therapy. Palliative means we give radiation therapy for symptom control. If there is profuse bleeding that is not able to control by other means, we give single fraction or 5 fraction or 10 fraction radiation therapy to get bleeding under control. If there is some obstruction in the esophagus, patient is unable to swallow anything, then we can give palliative intent radiation therapy to prevent its spread and, if possible, contain it and shrink it to a certain degree so that patient's lifestyle can improve to a satisfactory degree. That's what.
Does radiation also make the cancer spread faster, or does it make it more aggressive?
Not at all. No. It does not. It is in fact intended to prevent the spread of cancer, not spread it.
And can you, suppose say, a patient has undergone radiation therapy once in their life, and then many years later there is a recurrence. Can you undergo radiation therapy again and again?
Absolutely, definitely.
Is it safe?
It is definitely safe. There has to be a minimum time gap between the two courses of radiation therapy. Generally, it is minimum of 6 months, ideal of 1 year. And we can give repeat radiation therapy to the same site where the recurrence has occurred, or even to a distant site, keeping in mind the dose constraints of normal tissues are met. And we have sophisticated software and planning techniques to achieve the same.
So 1 year between, say, your last dose and then the first dose of the second?
Yeah, minimum 6 months, yeah.
What about time commitment? Is it a long, drawn-out process?
See, it depends again upon the site and the intent of treatment. If we are intending for radical treatment, the course can vary anywhere from 4 weeks to 7 and 8 weeks. Like for prostate, if we give conventional radiation therapy, 7 to 8 weeks. In head and neck, 7 weeks, right? In breast, 5 weeks. But if we are giving something known as hypofractionated schedules, we can achieve similar rates of control in a shorter period of time. Let's say we can give 3 weeks of radiation therapy in breast cancers rather than 5 weeks. Again, that is a variable depending upon the case and the patient also.
Yes.
In prostate, we can achieve similar thing in 8 weeks and less than 4 weeks also, with something known as SBRT, that is stereotactic body radiation therapy, that uses ablative doses of radiation therapy in very few sessions, 5 or 6 sessions we can achieve that. So it depends on the patient, the site, the size, as well as the stage of the tumor and the patient.
Also, area. We've heard of radiation therapy being used in things like cervical cancers and breast cancers. Is it also advantageous in hard to reach cancers?
Definitely, any site of body from head to toe, it can reach any site, be that atypical site, be that spine, be that brain. There's something typical known as ocular melanomas. In ocular melanomas, we can use brachytherapy.
Okay.
All right. So any site we can reach, even spine, with some millimeter accuracy.
Okay.
Within millimeters of accuracy, we can deliver high dose radiation.
What about things like oligometastatic diseases? Has radiation therapy been a game changer in such cases? Can you tell our viewers also what exactly oligometastatic diseases are?
So oligometastatic disease means a patient having primary disease and along with it 5 or less than 5 secondary lesions known as metastatic sites. We can definitely treat them with an intent to cure, right? With an intent to cure using advanced radiation techniques known as SBRT, stereotactic body radiation therapy. We can deliver curative intent doses in a very few sessions, let's say 5 to 8 sessions, to any site, provided they are less than 5 and they are of adequate size to cover under the SBRT planning process.
Dr. Vaibhav, we are also hearing a lot about combining treatments. Can radiation therapy be used along with other therapy techniques like, say, your immunotherapy?
Yeah, definitely. We can combine radiation therapy with chemotherapy, systemic therapy of any kind. As we have seen, concurrent chemoradiation that we call it is given for curative intent treatment of cervical cancers. It is also given in head and neck cancers. It is given in breast cancer, such as trastuzumab can be given. Then it is given in brain tumors. Targeted therapy can be given. It is given with brain tumors to achieve cure. So definitely it can be combined.
So you said that over the last 2 decades there have been huge advancements in the kind of cancer care, especially when radiotherapy is concerned. Would treatments also differ from hospital to hospital, the technology, the techniques used?
Yes, absolutely. It depends upon the type of linear accelerator machine or cobalt-60 machine that a particular center has. So technicality and expertise varies with the type of machine and the type of technique used. Like the latest ones that we have right now is MR-Linex, that is magnetic resonance linear accelerators, where a linear accelerator and an MR are mounted on the same machine.
Okay.
So that is the most advanced variant. Only few centers have this. Right?
Okay.
Yeah.
Are there also any advancements to look forward to, since technology is advancing so fast?
Yeah, proton therapy is the one.
It's the latest one.
It's the latest one. Yeah.
Okay. So do we have that in India?
Yeah, we have that in Chennai.
Okay, so now there is, so much of technology and there are so many different techniques that you just mentioned. There is also such a lot of information and misinformation, especially online. I mean, that would be the first place anyone would look, if you have, say, a cancer diagnosis. But what do you recommend a patient does, or whom do you recommend that a patient speaks to so that, they get their facts right?
Definitely, the first point of contact is an oncologist. The patient should see the oncologist right away, right? And if a patient or any other person wishes to obtain information, then look only at the official resources, international guidelines, NCCN guidelines, ASTRO, ISTRO, these organizations, all right, classical textbooks of our field. These are the true sources of information and knowledge, not any other.
Not WebMD.
No, not WebMD.
And definitely not Google.
Definitely not. Absolutely not Google.
There's a lot of, even social media now, everyone has so much to say.
Everyone is influencer.
Yes. Doctor, you've seen, so many patients over the years go through this recovery process. If there was one thing that you could say, I mean, cancer, a cancer diagnosis is in itself a scary one. But if there was one thing that you could tell our viewers who are perhaps afraid of radiation therapy, if there was one thing you could say to them, what would it be? Yeah,
definitely. First of all, it is an absolutely painless, life-saving, evidence-based, cutting-edge technology-backed procedure. Right? It is an integral part of oncology management, comprehensive oncology services, including medical, surgical, and radiation oncology. I urge you not to believe in anecdotal evidences or outdated information related to radiation therapy before making a decision. It is a very safe, absolutely painless procedure.
So there you have it. A big thank you, Dr. Vaibhav Shakya, for breaking down such a complex and misunderstood topic for us. Thank you so much for joining us here today.
Thank you.
If you or someone you know is facing a cancer diagnosis, we hope that today's conversation with Dr. Vaibhav helped replace some of the fear that you face with fact. Don't let myths stand in the way of you getting the care that you need. If you'd like to consult Dr. Vaibhav Shakya, he is available Monday through Saturday, 10 a.m. to 5 p.m. at Manipal Hospitals in Donapaula, Goa. Don't forget to share this episode, follow us for more expert-led conversations, and remember that informed choices lead to empowered healing. Thank you so much for joining us here today. This is Heather saying bye for now. Stay informed. Keep watching Prudent Media.